first, I'm going to be doing a blood drawing from a patient. So first I want to look at the record and make sure that the patient is supposed to be getting their blood drawn. I have noticed that the patient's name is John Doe. I want to just make sure that the patient's order is correct, and that I want to also look at all the supplies I need, go gather my supplies, and then I will head down to the patient's room. So now that I'm at the patient's room, I want to first introduce myself. Hello, I'm Lauren. Today I will be your nurse, and as of right now, I'm going to do a blood drawing for you. First, could I see your wristband just to make sure that you are who you are? And the patient's wristband does say John Doe, so I know that the procedure is for him. And so then I will proceed to close the curtains or close the door to ensure privacy. I will also make sure that there is adequate lighting. And then I would also like to position my patient in either a sitting or a lying down position, whichever one they are most comfortable in. And then I will also ask them, is there an arm or special location that they prefer to have their blood drawn? And he told me it's his right arm, so I will be doing on his right arm today. Okay, so first I want to do my hand hygiene. And then once I get my hand hygiene going, I want to put on a clean pair of gloves. I would also make sure that the patient is, the bed level is raised to at least my waist height, and that I am not reaching over my patient. Okay, so first I would like to find where I would to draw the blood from. So I'm going to put this tourniquet on. And so then I'm going to take an alcohol pad, and I'm going to start cleaning where I think I'm going to insert my needle, and I want to make sure to clean in a circular motion going outwards, so I don't clean the same spot twice and dirty up anything. And so once this dries off, I'm going to look again to see, make sure that's the vein I want, and that is. Then I'm going to release the tourniquet, don't want his arm to fall off. Then I'm going to take another alcohol pad since I touched it, and proceed to clean the site again in outward motion, making sure not to clean the same spot twice. Okay, so now while I allow that to completely dry, I'm going to prepare my needles and a lab. So, well, before I would have taken this out, I would like to make sure that none of my packages have been tampered with, that they're all new materials, and that if there are any expiration dates, that it isn't past that expiration date. Okay. So then, I could throw this away, and then I will sit this on a bedside table, but not being in a bed, I cannot do that at the moment. So then I want to make sure to get the tourniquet tight. And then now I would like to go on with my procedure. I will first remove the cap, make sure that my bubble is facing upwards, grab it by the butterfly wings, making sure not to stick myself or my patient. And then By stabilizing the arm and using my other hand, I would like to go in the low angle. Let me help you flash. Okay, so did you start? Okay. Okay, so now that the butterfly is in, I have noticed that I have a flash, and so now I am allowed to puncture my lab tube, so that I can receive blood. Okay. So while that fills up, I want to make sure that I'm getting enough so that the lab has enough to work with. So once that is finished, I can then unscrew that, and I will sit this aside on my tray, and I will label that later. And so then I would, using a gauze, I'm going to place the gauze on top of the entry site, and then I'm going to slowly remove my needle, making sure it still holds the entry site. I will then discard of my needle into the sharps container, and then I would hold this about no more than 2 minutes, making sure to remove the tourniquet. So once I notice that there is no blood on the gauze anymore, I will then put that to the side, and then I'm going to place a bandage over the patient's entry site. I will also make sure to clean up the area around the wound using a clean gauze. Make sure to discard of any soiled items, and gather all of my supplies, throw away anything that needs to be discarded. I would remove the waterproof pad, make sure to discard that. I would then remove my PPE, perform hand hygiene. Then I would raise my patient's bed back down to the desired level rather than waist length, and make sure that the patient is comfortable and see if they need anything else. And then if not, that will be all for today with the patient. And then lastly, I want to make sure that I label this with the date, the patient, the date of when it was collected, and then any other identification that the lab may need. And then I'm going to go walk this over to the lab, and they will test it there.